We all know that television can have a powerful impact, and tonight will be one of those nights. MedStar Health is going to be joining us for a special house calls event during which their doctors will be answering all of your questions about women's cancers. We've got Dr. Albert Abulafia. He is the Regional Director of MedStar Health Cancer Network and the Director of Orthopedic Oncology. Welcome, Dr. A, as they call you. How are you?
Thank you, Elsa. Happy to be here.
I'm happy to have you here. I want to just start out with, just the fact that there are millions of Americans who are diagnosed with cancer every single year. Research shows that up to half of the cases could be preventable, but it's just a matter of people getting screened or not screened, right?
Yeah, screening is a big part of it. We've made tremendous advances in treating cancer, but we'd be much happier if we didn't have to treat anybody.
Yeah.
And so prevention and screening has to be a strong focus.
And so, I see it says an estimated 1.7 million Americans diagnosed with cancer this year alone, and then more than 600,000 people will die. Of course, every October, we're reminded that it is Breast Cancer Awareness Month. So let's start with that. We're seeing pink all around us. So we want to make sure that it's top of mind. It's the most common cancer diagnosed among U.S. women and the leading cause of death after lung cancer. Why do you think that it is so pervasive?
We don't really know why breast cancer affects nearly 1 in 8 women over the course of their lifetime. We do know that there are ways of detecting it early. We encourage women at age 40 to 45 to at least begin the discussion about screening mammography. Certainly by age 45 for screening mammography, depending on family history and other risk factors. So one of the known risk factors is family history. Other things we know are diet, exercise, alcohol can all play a role in increasing or decreasing your risk of developing breast cancer.
And what about colorectal cancer? That is the third most common diagnosed cancer now, isn't it?
Yeah, it really is. And we're seeing a trend toward younger and younger people being diagnosed with rectal cancer, or colorectal cancers. We used to say to begin screening at 45. We've changed that to 40, especially in African American populations. And there are a variety of very simple ways of getting screened or tested for colorectal cancer. And some of those involve even home kits, and you don't necessarily have to go to a doctor's office.
Great. And, of course, we want to make sure that we're getting screened, but also we want to try and prevent it if we can. So what can be done to minimize the risks of cancer?
Yeah, so obviously number 1 through 5 is cigarette smoking. And people think cigarette smoking and tobacco exposure is just lung cancer. It's not just lung cancer. It's also esophageal cancer, bladder cancer. It predisposes you to more than just lung cancer, but that's certainly the big one. Secondhand smoking, obesity is certainly a risk factor, alcohol, certain diets that are excessive in meat and low in fruit and vegetables or low in fiber. And then, of course, sun exposure. We know about the risk of sun exposure, and we're much better this generation than we were previously.
So just to sum it all up, if we are trying to be our healthiest selves, what I'm hearing is that we got to get our screening done and we need to do everything you just outlined right before.
You're exactly right.
You're just taking care of ourselves day to day.
Yeah, and I think during this time of, people in crisis, we're learning sort of to address our own needs and take care of ourselves. So I do think it's important to have that discussion with your doctor and pay attention.
Well, we know that you were with us during our last House Calls event, so we're looking forward to having you again. Of course, it can be so helpful for so many people. We'll remind everyone right now, you need to watch. You're going to watch tonight, WMAR 2 News, tonight from 5 to 7:30, and get your questions ready for the doctors at MedStar Health Cancer Network. Dr. A, thank you so much. We really appreciate all of this helpful information, and we'll be right back with more Midday Maryland right after this. Stay tuned.